So good afternoon, everyone. This is the 2025 West Essex Regional School District Open Enrollment Presentation Webinar. My name is Elizabeth Roldan. I'm joined here by my colleague, Brian Atkinson, and we are IMAC Insurance. We are the broker for the district's health benefits. So any questions that you may have related to your health benefits, claim matters, or any questions now during open enrollment, please feel free to go ahead and reach out to our office. I know that I've had quite a few employees already call and email, and we're getting back to people same day, pretty much within the hour, because we know how time sensitive open enrollment is. And we want to make sure that everyone has an opportunity to learn about what plan changes, what options are available, excuse me, for the upcoming 2026 renewal year, and how those different plan options that you have available, how they compare to your current plan that you are currently enrolled in. So please feel free to call or email us at your convenience. Open enrollment began last week on October 1st, excuse me, and will be ending on Friday, October 31st. That is really today's biggest takeaway. I understand that rates are a very sensitive topic right now, and we are going to get into that in quite a level of detail. But I can tell you that the Friday, October 31st deadline is the most important takeaway, because if you do not make your changes before then, you will not be able to after the fact. And that is a deadline imposed not only by not by the district, but by the state health benefits. I can tell you that every year there is a segment of employees that wait until the last minute. They sometimes have issues accessing Benefit Solver's enrollment system, which is the only way that you can make benefit changes. And if you do need to call and have your credentials reset, I know that towards the end of open enrollment, they're already dealing with a very high call volume, but even more so towards the end of open enrollment. So I would encourage you to make sure that you have access to Benefit Solver, that you can get in without any issues ahead of time, should you choose to make a plan change. And that is something that if you are unable to access the system, you would have to reach out directly to the Benefit Solver hotline through the Division of Pension and Benefits in order for them to reset your credentials. So please make sure that you are going ahead and accessing that properly. If you are making a plan change to your medical, your prescription would also be affected by that, because any change to your medical would impact what prescription plan you're enrolled in. So if you are looking to make a medical plan change, you would have to go ahead and complete a paper form for prescription. And if you are enrolling in dental for the first time, you would also need to complete that on a paper form as well. All of your enrollment changes, again, adding, removing dependents or spouses, or making a plan change, the deadline for that is, again, Friday, October 31st. If you are not making any changes, you don't have to take any action. This is a passive open enrollment period, but we do encourage everyone to please double check that their plan and who they're enrolled in looks correct within the Benefit Solver system. As always, a good fail-safe just to have. If you've never been on Benefit Solver, which has been around for about 5 years, the website for that is mynjbenefitshub.nj.gov. If you've never been on it, you would have to register for the first time. It's going to ask you to verify some demographic information to ensure that you are the correct person logging in to access your personal health information. But if you've logged into before, just make sure that you have your cell phone near you, because it does require a two-factor security authentication to log in. So they will send you a text message in that moment that you're trying to log in order to verify that you are logging into the correct account. When you log into the Benefit Solver enrollment system, you will see that this is the landing page, the home page, and across the top, you'll see a banner there with a countdown of how many days are left in open enrollment. So again, it's very important that that October 31st deadline, that you adhere to that if you are looking to make any plan changes or adding or removing any dependent children and or spouses. If you are someone like me who loves apps, the Benefit Solver system also has a mobile app that you can download on the Android store or the iOS Apple store. And the app is called My Choice Mobile. You can truly do the same things on the website that you can on the app, including making changes to your enrollment, downloading a digital copy of your ID card, or uploading any documentation if you are enrolling a dependent child and or a spouse. You can do that all through the My Choice mobile app. So I highly encourage you, if you haven't downloaded that you do so. For those of you that are enrolling dependent children or a spouse for the first time, you would need to supply additional documentation to prove your relationship to that person. So, for example, if you are enrolling a spouse for the first time, a copy of your marriage certificate and or a copy of the joint tax return is required. If you're enrolling a dependent child for the first time, a copy of their birth certificate would be the applicable document. Again, this is only for people that are enrolling a spouse and or dependent children for the first time. If you've already had your other family members enrolled, you don't need to go ahead and complete this. This has already been done since you initially joined State Health Benefits Insurance. But again, for anyone who hasn't done that yet and is going to do that during open enrollment, this is the documentation that the state requires that you supply as you are completing enrollment for that spouse and or dependent child. During the 2025 open enrollment period, there are 4 plan options that are available. In the state health benefits, the choice of carriers are Aetna and Horizon. Horizon only offers Direct 10, Direct 15, and the Educators Plan, as the Garden State Health Plan is only offered by Aetna. The rates and the benefits are exactly the same by both carriers. The only difference would be the network of providers. So when you're in state health benefits, you do have the option of either or carrier, with the exception of the Garden State Health Plan that is the only carrier for that plan. As an employee, and I get this question all the time, so this is a perfect opportunity to address it. If you are someone in Direct 10 and in Direct 15 that is looking to make a plan change, you can make that plan change. And for example, if you wanted to move into the educators plan for 2026, you are only obligated or committing to 1 year. You can always go back to Direct 10 or Direct 15 if you were in that previously. In the state health benefits and the Chapter 44 law that was passed a few years ago, as long as you were hired before July 1st of 2020, you can elect from any of the 4 plan options that are being offered at every open enrollment period. If you are hired on or after July 1st of 2020, your only plan options would be the New Jersey Educators Health Plan or the Garden State Health Plan. We have detailed comparisons on the IMAC benefits portal, as well as on Benefit Solver. And I know in the information packet that you received from Chrissy, you should have received a copy of a comparison with all 4 plans side by side. So you would see how your copay, maximum out of pocket, and other highly utilized benefits were compared to one another. The other question that we get a lot, and again, really important question that happens during open enrollment, and especially this year with the double-digit increase that the state is projecting and what they've finalized already, is the difference in contributions and how those contributions are actually calculated when you're in either plan. So for example, if you are someone that is in Direct 10 or in Direct 15, the coverage tier. So if you're covering a family, single to adults, or parent and child coverage, your salary and the premium of the plan, those 3 factors are calculated, and that is how we arrive at what your per pay contribution amount will be. Whereas if you look to the right, the New Jersey Educators Health Plan or the Garden State Health Plan, the only things that are utilized to calculate what your contributions will be are the coverage tier and the salary. So even though the state is facing double-digit increases next year, for those of you that are already in the New Jersey Educators Health Plan or the Garden State Health Plan, you will not see an increase unless your salary or your coverage tier changes. The premium of the plan is not factored into that contribution. So employees that are looking to save money, you will have a guaranteed savings by moving into the Educators Plan or the Garden State Health Plan. But again, and part of what we're doing today is educating everybody on, yes, there will be a savings by moving into either of those plans, but there are plan differences, which is what accounts for the differences and the savings between these plans. For those of you that are looking to stay in the Direct 10 or into the Direct 15, you will have a significant increase come January. We are actually fielding one-on-one phone calls with employees now because we want to make sure that while we know that the plan will work for you financially, it has to work for you medically. And that means that the plan differences, which are primarily out of network, and the prescription coverage, which are the two biggest differences amongst these plans, we want to make sure that they work for you, because the last thing that we want is for you to go ahead and make a plan change. Come January, you can't get the prescription drug that you were looking to get covered, or that the out-of-network doctor that you're going to is not going to be reimbursed in the same way that it is currently under Direct 10, for example. So those are the one-on-one questions that we definitely want to connect with you about. Feel free to email us, call us. We are making sure that we're getting back to you as soon as possible, because we want you to have all of the information really necessary that you need in order to make this plan, if you're looking to make a plan change. But yes, in the educators plan and in the Garden State Health Plan, there is a guaranteed savings just because of the way that it is calculated, as you can see, because the premium of the plan is not factored into that calculation. And just to take it a little bit of a step further, if you're in, this is the table of contributions for the New Jersey Educators Health Plan. So if you're an employee that, for example, has a family plan and you earn $75,000, your costs will be 5.5% of your salary. So you would take that $75,000, multiply that by 5.5%. That gives you an annualized number that you would divide that amongst the pay periods that you have. If you're a teacher, that would be over the course of 20 pay periods. If you're a administrative person there, or on a 24 pay frequency, you would divide that by 24, and that is how you arrive at what your contribution costs will be. We also have a calculator on the portal, on the IMAC benefits portal, and we can also run these numbers for you. So if you want to call us or send us an email, I see some of you on that are here right now that I've already spoken to. Call us, tell us your, let's go over your numbers, your information. We'll run the numbers for you and let you know exactly, should you go and stay in, let's say, Direct 10, what that cost is going to be come January, or if you were to move to the educators plan, what that cost would be also as of January. The Garden State Health Plan also has a separate table. As you can see, it's a usually a half percent less than what it is under the educators plan, or half the contribution amount, I should say, excuse me. But again, really big plan differences, and we're going to get into those right now that we want to highlight to all of you. So if you're considering staying in the New Jersey or going into the New Jersey Educators Health Plan, I should say, the New Jersey Educators Health Plan offers the same network of doctors, whether you're in Direct 10 or in Direct 15, or if you're in Freedom 10 or Freedom 15 if you're under Aetna. It is the same network of providers in the New Jersey Educators Plan. So anyone that you're seeing in network today, you're going to be able to see them and pay just a copay, because they will be in network providers if you move into the Direct 10, or if you move into the educators plan from the Direct 10 or Direct 15. The Garden State Health Plan, however, utilizes a smaller network under Aetna called the Aetna Whole Health New Jersey Network. And the big difference there with the Garden State Health Plan is that the Garden State Health Plan only offers coverage in the state of New Jersey. So if you are traveling outside of the state, and let's say you spend your summers in Florida and you want to go see a doctor out there, the Garden State Health Plan will not have coverage outside of the state of New Jersey. Or if you have a college student dependent child that lives outside of the state, and you are choosing to go into the Garden State Health Plan, they will not have coverage outside of the state of New Jersey unless it's a true medical emergency. So that is a big, big takeaway if you're considering the Garden State Health Plan. For the most part, we don't see a lot of migration and interest in that Garden State Health Plan just because of the network restrictions associated with it. Most people that are in Direct 10, Direct 15 are looking to potentially move into the educators plan. So that's really the two plans that people compare the most. As we mentioned, contributions for the New Jersey Educators Health Plan and the Garden State Health Plan are calculated as a percentage of salary rather than a percentage of premium. But under either plan, the copay for your primary doctor, which you don't have to elect a primary care doctor, you don't need referrals at all to see specialists, but the copay for that primary doctor is $10. For a specialist, it is $15. If you go to the emergency room, that is a $125 copay. But again, like it is with your other two plans, it is waived if you're admitted into the hospital. The out-of-pocket costs are higher if you go out of network, which we do have an example coming up of what that could potentially look like. And as I mentioned, the formulary or the prescription coverage is different. where the Garden State Health Plan and the New Jersey Educators Health Plan have a smaller list of covered drugs. Those drugs also have a mandatory generics requirement where even if your doctor writes brand, the generic is what's going to be covered. So for example, if anyone here is on Crestor, for example, Crestor is not a covered medication because it has a lower cost generic option available. So if your doctor writes Crestor on the script, your pharmacy will be covering and dispensing rosuvastatin, which is the generic for that. I know a lot of people that are on generics already. You may be on a drug that you don't realize is a generic already. So when you're doing your due diligence, if you're considering moving from Direct 10, 15 into the Educators or Garden State Health Plan, that's the time to go ahead and review your utilization on your medical plan, see how much you're going in and out of network, and also how you're utilizing your prescription plan. Are you already on generics? Are you on certain brand name medication that we can help you do some research on to see how they would be covered under the Educators Plan or Garden State Health Plan? And just to give you a high level side-by-side view, as you can see, the networks are exactly the same under Direct 10 and under the Educators Plan, for example. But again, the Direct 10, the Direct 15, and the New Jersey Educators Health Plan are the only three that offer coverage outside of the state of New Jersey. Whereas Garden State, it's a smaller network only with Aetna and coverage only in the state of New Jersey. Your primary care and your specialist copays are going to differ slightly depending on the plan that you choose, but are kind of in that same $10, $15 ballpark range. Your annual physicals are covered the same across the board in all four plans, as in the state health benefits, they're covered at 100% in network only. So if you haven't gotten your physical yet, we're in October, there's still time. Take advantage of it. It's at no cost to you, and you'd be surprised at how many things are picked up and detected early at your annual screening, even to set up a baseline of how your blood pressure trends and how your other numbers trend. So having that baseline information by getting your annual physical is incredibly important. And we also wanted to mention what deductibles, out-of-pocket maximum. This is something that we try and touch upon at every open enrollment because people just, again, we're in the insurance world, so we get it because we live, sleep, and breathe this. But for those of you not in the insurance space, this is something that gets confused commonly. So your deductible is the amount of money that you as a member would have to lay out before your plan starts paying. As you can see across the board in all four plans, in network, there is no deductible. If you go out of network, depending on whether you have single coverage or family coverage, you would have an out-of-network applicable deductible as laid out here on the screen. Maximum out of pocket, however, is the most that you would lay out in a calendar year. So for example, if you're someone in Direct 10, as an individual, your maximum out of pocket is $400. So what that means is any co-insurances, any co-pays in network that you accrue up to $400 in a calendar year, anything after that would be covered 100% in network. So under the Direct 10, it's $400 for an individual. Under the New Jersey Educators Health Plan, it's $500. So again, maximum out of pocket, the most that you would spend in a calendar year. Deductible, think of it like car insurance, where you have to lay out something before your car insurance carrier picks up the rest. As we mentioned, there are no referrals required in any of the four plans. Your labs are exactly the same across the board, with LabCorp and being your preferred in-network labs in network. If you go out of network, you do have your applicable deductible and or co-insurance. Same thing with outpatient surgery, covered 100% in network. And you'd be surprised at how many surgeries now are outpatient. Even something that used to be a hospitalization like a hip replacement, you're in the morning, you're out by lunchtime. So definitely outpatient surgery has come a long way, and again, covered 100% in network with your applicable deductible and co-insurance outside of the network. And your emergency room copays vary depending on the plan that you're in, but again, they are waived if you're admitted into the hospital. Okay, so when we talk about out of network, which is one of the big plan differences between Direct 10, Direct 15, and the Educators Plan or Garden State Health Plan, is that when a doctor is in network, they have agreed contractually to not bill you anything above a copay. So anyone that you're seeing now that is just charging you a copay, they are most likely an in-network doctor. When you go out of network, those doctors, because they don't have a contract with your carrier, they really can bill whatever they want. And that difference between what the plan would allow, what they consider usual, customary, and reasonable, and what the doctor bills is considered balanced billing. So we have an example coming up next to show you really what that broken down would look like. But it's important to note that under the educators or the Garden State Health Plan, that out-of-network reimbursement is much less than it is currently under your Direct 10 and under your Direct 15 plans. So thinking about how you utilize your plan, whether you go in or out of network, is also very important. We see a lot of utilization with people going out of network for mental health specialists, pain management facilities, chiropractic. So think about how you're utilizing your plan. How often are you utilizing your plan out of network to see if it makes sense for you to go ahead and switch into a plan that's going to reimburse you less out of network. Because if you do switch to the educators or the Garden State Health Plan, you are going to have less money reimbursed, which in turn means a higher out-of-pocket cost. So the example that we like to use is, for example, you go out of network to a doctor and that out-of-network provider bills you, let's say, $100. Whether it's Horizon or whether it's Aetna, they're going to look at that claim to see what they would have paid had it been in network, what they determine to be usual, customary, and reasonable for that service. And in this example, let's say they determine that out of that total bill of $100, $50 is what they would have considered usual, customary, and reasonable. Aetna will go ahead and in this blue box pay their 70% in coinsurance, which is $35. You as the member will have $15 coinsurance. That's your 30% that you're paying for. That coinsurance gets applied towards maximum out of pocket. But this other $50 here, down here in red, that we haven't even touched upon, that would be owed from you to that provider, and that is what is known as balance billing. We use $100 as a low number, very hypothetical. Most people that are going out of network are usually seeing some type of specialist, and usually it's a very expensive specialist. So it's important that whether you're going to a provider or whether you're having a procedure done that's out of network, that you have a full understanding of how much potential out-of-pocket expense you can be billed for. You can actually have what's called a predetermination of benefits if you're going to an out-of-network provider to see what your potential, what you're going to be billed and what your potential out-of-pocket could be. So it's important that you have those open conversations if you're going out of network in one of these two plans, because again, you want to make sure that you're controlling your costs as much as possible, which is why there is a high encouragement to utilize in-network services, because you can control your costs that way. But if you're going out of network, you can have those candid conversations with those providers just so you don't have a surprise bill after the fact. As we mentioned, the prescription plan would differ a little bit if you are moving from Direct 10 to the Educators Plan or the Garden State Health Plan. The two big differences are that the prescription in the Garden State Health Plan and New Jersey Educators Health Plan is a smaller list of covered drugs, and also that they have the mandatory generics requirement. So again, even if your doctor writes brand, even if you're currently on that medication, even if your doctor can prove medical necessity for that medication, if it's not covered under the Garden State or the New Jersey Educators Health Plan, it's not covered. And that's a very important thing to really do your due diligence on. I've been fielding a lot of questions over the last 2 weeks in anticipation of open enrollment, and I've had to tell people ahead of time, hey, your Tremfya or your Zepbound or whatever drugs in their specific plan, how they're not covered. And I've had members say, well, but what if my doctor writes a note, or what if I do an appeal? If it's not covered, it's not covered. So that's important that you understand that, and that before you make your plan change, that you figure out, hey, either I can go and use another drug within that same therapeutic class of drugs, or this may not work for me this year because I need to be on this medication for now. What I like to tell people is that formulary lists are also subject to change. As new drugs come onto the market and are approved by the FDA, formulary lists can change and do change. And that really is something to also be cognizant of. So it's important that you know that there will always be a drug for every single condition, but it may not be the one that you specifically want. An example that I also like to use is for a drug called and I'm sorry, I missed the name of it. There is a drug for GERD that is an extended release drug that members take once a day, and it's extended release. They don't have to take it, multiple times a day. That drug, for example, is not covered under the educator's plan. But in that same therapeutic class, a drug that is a 20 milligram prescription that is taken 3 times a day, also for the same treatment of GERD, that drug would be covered. So again, there's always going to be a drug for every condition, but please make sure that you double check your medications. We see it a lot with differences in certain inhalers. There are certain inhalers that are not covered, certain ones that are. Same thing with certain insulin. If you and or someone on your plan is a diabetic, that's also something to think about, because there are certain insulins that are not covered. So again, we want you to reach out to us. Feel free to email us with a list of all of the drugs you and or your family are on. We will do that work for you and that research for you, just to make sure that you know ahead of time, hey, is this going to be covered or not? And if so, what's my out-of-pocket exposure here? So with that said, next steps. If you're not making any plan changes, you don't have to take any action. Again, this is a passive open enrollment period, but again, we do encourage everyone to double check their coverages to make sure that all of their information is correct. One of the things that we see a lot is that employees don't update their employer and or benefit solver when they move. So a lot of the times, let's say you make a plan change, it's nearing the effective date, you haven't received your ID cards. A lot of the times we tend to see that it's because you didn't update your mailing address. So again, verifying that all your information is correct in the system, I would say, is highly important. But if you are looking to make changes or waive your coverage, you do have to go ahead and do that on Benefit Solver and or on the paper forms for prescription and dental. And we do have all of that, all the forms, links to everything on the IMAC Benefits portal. And remember, you're making a plan change for the 2026 calendar year. You'll have another open enrollment opportunity next October to go ahead and make changes. And again, that big takeaway today, deadline of October 31st, because no changes will be allowed after that. Just as a reminder, the IMAC Benefits portal that we keep referencing throughout this call is imacbenefits.com. It'll ask you for what's called a guest key, and you will type in all in caps, WEBOE. All of the information that we've referenced today, including the contribution calculator, are posted there now. Once the recording for today's session is generated, we will also post a link for that as well. And for the calculator, this is what it looks like. It is in Excel. So if you try and open it with Google Sheets, it will not work. But feel free to reach out to us. We will go ahead and run those numbers for you and let you know if you stay under your current plan, what your contributions will increase to, or if you move to the educators or Garden State Health Plan, what your savings would be. So we can help you with that at any time. And while this is open enrollment, we understand that life happens outside of open enrollment. So if you do have a life event that happens outside of open enrollment, you have 60 days to complete your enrollment and documentation within Benefit Solver. So for example, if you got married on September 1st and you haven't had a chance to enroll that spouse, you have 60 days to do so. And the coverage would be retroactive back to that September 1st date of that qualifying event. If you are looking to terminate coverage, however, because you're gaining it elsewhere, let's say through a spouse's plan, you have 30 days to terminate that coverage, again, outside of open enrollment. But now that it is open enrollment, this is your opportunity to make any plan changes, add or remove dependents, waive coverage, or enroll if you've previously waived that coverage. For those of you that have dependent children age out at the end of the calendar year in which they turn 26. At the end of that calendar year through the state health benefits, your child would automatically be offered COBRA. If they meet certain criteria, which we will touch upon in the next slide called Chapter 375, they may be able to stay on the same plan that you are currently enrolled in at a much lesser cost than COBRA. And if you have a special needs dependent, there is coverage continuation for overage dependents with disabilities. We do have those forms on the IMAC benefits portal as well as on Benefit Solver. But if you have any questions or need help in how to complete those forms, please feel free to reach out to us. One of our team members will help you. For those of you, again, with dependent children that are aging out, if that dependent child is unmarried, has no dependents of their own, lives in the state of New Jersey or is a full-time student outside of the state and is not entitled to any other group plan or Medicare, they would be eligible to enroll in just medical and prescription of the same plan that you are currently enrolled in until the age of 31 for about 66% of the premium cost. We mentioned Chapter 375 because it is a much less expensive alternative than COBRA. COBRA charges 102% of the premium, whereas Chapter 375, if they do meet this criteria, is going to save them a lot of money. So again, if Chapter 375 is something that is applicable to you or that you want more information on, we have it posted on the portal, but you can also reach out to us and have those one-on-one discussions. For those of you that may be coming on to benefits for the first time, Horizon does have a doctor finder as well as Aetna. But again, if you're staying in the Horizon world, where from going from Direct 10 or 15 to the Educators Plan, that is going to be the same network. If you're in Freedom 10, 15, or the Educators version of Aetna, that's the same network. But if you are looking to move into the Garden State Health Plan, I would highly encourage you to go to aetnastatenj.com to do the search under that Garden State Health Network if you are looking to make a plan change into that. As a state health benefits member, you are entitled to enroll in something called NJ Well. It is a wellness incentive program that the state offers for anyone who's enrolled and their spouse, where by doing preventative service activities such as your physical, your dental cleaning, a vision checkup, you can accrue points to earn a $250 gift card. The program runs November 1st through October 31st, so we're nearing the tail end of this current year, but you can certainly start it back up on November 1st. And if you go to nj.gov/NJWell, you can sign up through that website or through the Benefit Solver website as well. We also have a link on this on the IMAC benefits portal. We also have the plan overviews, which I also believe that Chrissy sent out last week. We have them posted on the portal as well. And within the portal, you can go ahead and do a plan comparison as well. With that said, that really brings us to the end of our presentation. Chrissy, Melissa, I'm not sure if there's anything that you want to touch upon that maybe I missed, but again, I will not get sick of saying it, October 31st. That is the big takeaway today to make your open enrollment plan changes. Okay. With that said, I do have our contact information here on the screen. Please reach out via email. You can call our office as well. And we are more than happy to go ahead and help you with your open enrollment changes. I thank you for attending today's webinar, and Chrissy and Melissa will share this link shortly once it's available, so it can also be emailed out to everyone besides being posted on the portal. Okay. Thank you so much, everyone. Have a great rest of your afternoon. I appreciate your time today. Thank you.